Hi guys, I came back today to share a birth story. I know it's been a bit since I uploaded anything, but I wanted to get on here and share a birth story because I have been so blessed and encouraged by listening to other people's birth stories over the years. Before or after birth, I feel like they can really bring a lot of comfort or even shed light on situations, bring information, just help you feel maybe not so alone in some of your own experiences if you're reflecting on them after birth. And I know everybody has a different birth experience, not saying that yours should look or be like mine at all, not trying to make anybody fearful of birth or have a pity party about my birth story. Just feel like maybe sharing it, other people could identify with things that they went through or maybe draw comfort, like I said. So the birth of my first child was a bit ago. I didn't know what to expect, as most first-time moms don't know what to expect. Both my husband and I, because of our history with infertility and going through so much medical treatment with IVF, so many tests and injections and medications and follow-up tests and, just having to know everything about something before you could, get into it with pregnancy. And then once you're in pregnancy with infertility, it's kind of scary and you're expecting things to go wrong and you're being followed closely, and it took some of the joy out of pregnancy, not saying that I wasn't extremely thankful for that pregnancy, but it's different than when you conceive naturally and it's more of a surprise. And so anybody going through infertility probably understands that it's just different. And because it was so medicalized, the pregnancy and getting there, I really wanted the birth to be as natural as possible. So my husband and I decided not to find out the gender. We wanted a surprise since we hadn't gotten a surprise up until that point. Everything was so known. We wanted something to look forward to in that sense. So we just decided to do things as natural as possible. I went to a midwifery center for my prenatal care, and they definitely encourage natural birth, obviously, as they can't do very many medical interventions in that setting. And they just really kind of emphasize letting birth be the natural physiological process that it is for most people when they're healthy and the baby's healthy and there aren't known complications. So luckily the pregnancy was healthy, and so that's the route we got to go. I remember though getting to 40 weeks and no baby yet. I think everybody who hits that, it's just a little, you're disappointed because you're so ready to meet them, and then you start thinking, is the baby ever gonna come? So I had my appointment with the midwives early in that week, and the midwife that I met with that day didn't necessarily have the best bedside manner. She was kind of short. In any case, I was under the impression with their practice that I would have till the end of 41 weeks until I was risked out or transferred into other care. But she said I only had until the end of that week, so the end of my 40th week, before I would have to transfer. So being very pregnant and full of hormones, and I was kind of short and not very kind with her at that appointment because I was kind of caught off guard by that. It wasn't what I had understood, and a little scared of what that meant, because everything I had done up until that point, was really striving for that natural birth setting. So I left that appointment, and was definitely, a fire was lit underneath me to try and get the baby out, as most people look up ways, the best ways to try and get labor started. So I was doing a lot of walking, and at that point I had stopped working just a few days prior to that, so I could walk a lot. I went to the botanical gardens and walked around all day, and had planned to go to the zoo the next day to walk around. But that night, I got up to go to the restroom, as is very common in pregnancy, especially late pregnancy. And after emptying my bladder completely while leaning forward, I felt and I heard a pop, and then I felt some more liquid. So I'm like, okay, that was something. And I went back to bed. It wasn't a full-on everything gushing. It was a slow trickle water break. So I went back to bed and then got up again just to make sure it wasn't in my mind. And sure enough, when you lie down, it kind of doesn't come out, and then when you stand up, gravity is helping any water that's pooled, it all trickles again. So I'm like, okay, yeah, water has broken. I got out of bed, and it was close to midnight, I think. Walked out into the living room area, just stood on the rug as my water was leaking out, and called for my husband because he wasn't in bed. He had gone to check on the dogs downstairs or something and fell asleep. So I just remember calling for him to come upstairs that my water had broken. It was exciting to finally have something like that so definitive, that the baby was coming, labor was imminent, because sometimes you just don't know what to expect with contractions when it's your first child, and if it's really labor or not. I guess we called the midwifery and let them know, and they encouraged us to come down and make sure that it was my water that broke, and make sure baby was head down and that type of thing. So within probably 30 minutes, my contractions had kicked in, and they were not super strong and they were not super close together, but they were regular. About every 10 minutes I was having some contractions at that point. We didn't live super close to the midwifery, so we drove down, and without any traffic in the middle of the night, it was over 40 minutes for sure. And with traffic, which gets pretty bad, it would be an hour. You could tell she felt badly for me that I was getting transferred when it wasn't my birth plan or wish to go to the hospital, but I had really hoped for that natural birth, and it wasn't happening. But she had other people to look after as well, and couldn't just stay there and hold my hand with that situation. It was a midwifery center where they had one, maybe two midwives on duty. for multiple rooms. So there were other women in active labor who needed her. And I remember asking her, how the epidural would affect my baby if I got an epidural at that point. And she was encouraging me that it might help my body relax and give me a break to rest in order to let the baby come naturally. So at that point, I agreed to the transfer, which was more or less not optional at that point. And the baby was showing no signs of distress, and I was doing okay. I was just exhausted and in a lot of pain. So it was time to be transferred to a very nearby hospital. I walked out in the hallway, and they actually had an ambulance already on the way that was almost there because another mama who was laboring requested to be transferred. She wanted to go to the hospital instead of have the natural birth at the midwifery center. And they called that ambulance for her, but her baby was coming right then. So even though she wanted to be transferred, it was too late for that. And she was having that baby, and I just was gonna take her ride, I guess. I remember hearing her laboring as I was waiting in the halls for it, and the real screaming guttural sounds that can come with labor sometimes, and the midwife and her spouse encouraging her to push. She said, "I am pushing." It was just, you could hear a lot of through the walls. It was interesting hearing other people birth when you're in labor. It's an interesting memory. But the ambulance arrived. They wanted me to get on the stretcher because that's just their protocol. Even if you feel like you can sit in a car to go to the hospital, they have to do it that way. I remember I got on the stretcher and they got me strapped in, and I told them I have to get back up because I was having a bad contraction, and it was just intolerable when I was lying down and strapped down. So they let me back up, and I got through that contraction before I could get back in and go. So I got in the ambulance, and it was the midwife's protocol to have a midwife accompany you to the hospital for that transfer, kind of make sure that, the right information is all exchanged and that you don't feel alone in that process of being moved, I guess, which is nice. I ended up getting the midwife that I had seen for that previous midwife appointment to accompany me. It wasn't the midwife that was helping me through the labor that night, or the one who had checked the ultrasound positioning of the baby, but the one that I had kind of an issue with at my previous appointment, and I was rude to, and I felt badly about that. I could tell it was a God thing, just bringing her back into my life at that point, and a chance to humble myself and apologize for how I acted. Just thank her for her help in that moment instead of focusing on, whatever. She accompanied me to the hospital. I got to thank her and apologize for any rudeness that I had conveyed previously. And then I was handed over to the midwife team at the hospital. So it was a hospital that had midwives on staff there as well. They did offer an epidural, which I accepted. The epidural placement was successful, which I'm really grateful for. I know sometimes it's not. Sometimes it fails, or it can cause other issues. I was a little bit naive to some of that when I decided to get it, but thankfully it was placed well, and it did take away the pain. It was maybe too effective in that I couldn't feel my contractions at all. I know sometimes their goal with it is that you can still feel pressure and some of that without feeling as much pain. But it did allow me a chance to get some rest, which I'm really grateful for as well. The plan with the midwives once I got into their care was to let my body have that, I guess, little rest, and then to start Pitocin with the epidural, which is kind of what usually happens because epidurals often slow your labor down, and mine was already slowing. So they started the Pitocin, and they wanted to do an internal monitor on the baby's head, which I asked them about. I'm like, isn't that a greater risk of infection and that type of thing, since my water's already broken, and these types of things, it's been broken for a while. And I just found myself in a place that I had dreaded being as far as the cascade of interventions. Like reading about natural birth and that type of thing, taking classes about birth before I got to this point, I understood that like once you do one intervention, it leads to more interventions most of the time. So, like I said, once get the epidural, oftentimes your contractions slow down, and mine were already slowing, so the Pitocin was started, and then they need to do monitoring and different things because of those interventions. And so they had me rest with a peanut ball again in bed to try and open up my hips. I was still really hopeful that my body would relax, that the baby would get into position. But I was so kind of tired, and I didn't even know what to do or what to ask for at this point. Having a birth plan is there because once you're in labor, it's hard to really think through things and stick up for whatever you've decided or convictions you feel about this, that, or the other thing. I know my husband was exhausted too, so he wasn't able to really communicate effectively for our desires and that type of thing. So I was basically getting the Pitocin. They were increasing the level of that to try and move things along more quickly. It hit a point that the baby did not tolerate, and then they had to use a reversal agent once the baby was showing signs of distress. And then after that point, they could not run the Pitocin at more than a minimal level to avoid more trauma to the baby or endangering them. So the nurses had checked me. At this point, I was like 9.5 centimeters, but feeling no urges to push, no signs to push. And I didn't know what to expect with feeling an urge to push other than reading other people's stories about it. Sometimes their urges to push were overwhelming, and their body just did it, and I wasn't feeling anything, both because I didn't know what to expect, but also the epidural, I couldn't feel anything. So I went through just kind of what they were telling me at that point of what I needed to do versus being in tune with my own body or knowing what my body was doing. There was a shift change, and the midwife that I had at that point, unfortunately, she was probably the one negative experience of the hospital. She just, I don't know if she had some kind of bitterness or something in her past that she was hanging on to, but she didn't seem kind or empathetic in my situation at all. I just remember her coming in and telling me to get over it. I'm just going to get a C-section and I need to make peace with that. She was cold and hard and hurt me. I was that kind of low already of everything going opposite of what I wanted and being in a lot of pain and then just being really tired everything with a long labor that is entailed. I would have loved somebody to be a little bit more caring in the way they address things, even if she was convinced in her mind that I needed a C-section. Without a doubt, I feel like she could have said that in a lot of different ways besides the way she decided to do it. But in any case, she's the midwife I had, and could tell she was not fighting for a natural birth for me and wanted to just get this over with as quickly as possible, do the C-section and be done with it. I tried pushing. The nurses felt and pushed back a little cervical lip that was hanging over, and were trying to coach me through pushing for a while. I pushed for 3 hours, and although there seemed to be some progress of, you could see the baby's head and baby would come down a little bit, they'd go back up. And I didn't know what to expect with pushing, what to do. I tried my best just following their instruction, and ultimately they decided, you've had enough time, this baby's not coming out, it's time to do a C-section. That's pretty much what happened. A doctor came in and she was telling me it's time to do a C-section. Even though the baby wasn't in distress, they felt like it had been long enough that it was the only option. And I asked them about a vacuum assisted birth or forceps, because I was so gutted at that point to go down the road of a C-section when everything else had fallen along the way already of a natural birth. And I knew that there are some things that come along with a C-section, some complications, and not saying that it's not a good option, especially in emergent or urgent situations, but I didn't feel like I was quite there. I felt like the baby was still doing okay. I was still doing okay. I just wanted to give that a try. And unfortunately, it was kind of like they had given me all the time that they really could. The pushing wasn't being productive, and they couldn't up the Pitocin and that type of thing based on the baby's response earlier. So they decided to do the C-section, and I agreed. I was so tired at that point. I didn't know what to do or feel like I had any strength to draw from. So I agreed to the C-section, and they got us prepped and in there, and the baby out in a very short time. I know they gave me more medication, obviously, for that, including more antibiotics with all the risk of infection and that type of thing with an abdominal surgery. So felt pretty sick and threw up, but I was awake for my baby to be born, and I'm thankful for that. So if you don't process those feelings and thoughts, it's not good. You have to grieve the birth that you wanted. If your birth doesn't go as planned, which a lot of times they don't, you just need to know that that's okay, to really not be okay with how it went, and to grieve what you had hoped for and lost in that process, or what you didn't have, especially if this is your only child, or you're not going to have another child, it's your last birth, or whatever. You need to realize that processing those emotions and feeling like you lost something, it's normal when things go that differently than you had planned for or anticipated. Not brush it off as silly, but to heal and process that in the best way you can, whether that is going through it, talking about it with someone, reading, prayer, I felt that after my birth, I was overjoyed to have a baby that I never thought I could have when we struggled with infertility so long. But I was really struggling with the birth I had and feeling like my baby wasn't even my own at times because I didn't birth her. I know that sounds really weird, but you need to process that and heal from it if it wasn't an ideal birth, if it was traumatic in some way, which is different for everybody. Sometimes people who have a very precipitous, quick labor feel traumatized by it. Sometimes people who have a very long labor feel traumatized by it. The way people are supported in their labor or not supported by healthcare personnel or the people who surround them, that can be one of the biggest things, though. Just in a vulnerable situation, how they are treated can make a big difference. But I wanted to come on here and share this story of a natural birth that turned into a transfer, that turned into a C-section, and just share that with you guys because I've enjoyed listening to other people's births, and I know that there are probably other people out there who found themselves in the situation of not what they expected, or disappointment with how things went, or maybe just preparing for labor and what could happen. I just wanted to encourage you that I don't look back on that birth in the negative light that I once did. God can heal and redeem things, and He has for me. I know that I asked myself and God, why did my birth go this way? Why did this have to be the way it went when I tried to do everything in my power to make a successful natural birth the way things would go? And I don't know that I'll have any good answers to that, but I do know that I've been humbled by that birth, and I've been able to empathize and sympathize with countless other women, friends, and people who have had to get a C-section when they didn't expect to, or just didn't have the birth they wanted, or had a really hard time breastfeeding, etc., etc. Those challenges have enabled me to be sympathetic and empathetic to those situations and be a friend that can really understand them versus not. So I am grateful for that first birth and what it taught me about birth. I had no idea what I was getting into. I had no idea birth would be that long. I had no idea the feelings and emotions that can surround it when you're in the middle of it, making decisions for you and your baby. It's a big thing, but I will say you get through it. Even when it's painful, even when it's hard, you get through it. And while many people would choose not to go through those things, they do prepare us. They do help us and shape us if we let them. They make us stronger so we can be mothers and make really hard decisions and go through sleepless nights and do those things that aren't fun when it comes to being a mom. It's kind of like just refining us in a way through that trial, through that struggle. So while I questioned a lot why, early on, I look back And I know God was there. I look back and I see that both my child and I came out healthy, and I'm so thankful for that. I'm so thankful for the care that I received from midwives and the hospital staff. Everything can be redeemed. God is good that way, and I just want to encourage you, if you're scared about birth, or if you're struggling with birth, what happened, to just seek God on it. Be encouraged. You're not alone. A lot of other women have gone through hard births. You're not alone, and you can come out stronger and more resilient for going through the trials or suffering that you do go through. Try and find some meaning in that, and help other people in their suffering when you come across those other people who are in the midst of it and need some kind of encouragement, some kind of hope to cling on to. So yeah, that was the first birth story, and I'll be sharing some more of those birth stories.